Recording in progress.
All right, we're live. Thanks so much for coming, guys. I'm Dr. Andrea. This is my business, Movement Physio and Wellness. We're a physical therapy, pelvic floor physical therapy clinic. We also have an occupational therapist that works here as well. We love pelvic floor. We love pregnancy. We love postpartum. We love anyone with the pelvic floor, no matter what the gender is. So we treat anybody, anyone. But we love to have little workshops too, and little like intimate groups and things like that. So thanks for spending time tonight to come and hang out with us and meet us. Last time I did this, everyone was sitting on the ground, and so I was like, I got to bring in the chairs because the pregnancy is harder to sit on the ground, isn't it? So yeah, I'll tell you a little bit about who I am, who we are, and then we're going to talk about a lot of good stuff that you probably might not get in like a hospital-based birth prep class. You know, I had my kids at Lutheran, so those were a lot of like how to take care of the baby and yes, some laboring and breathing techniques. But I feel like even as a physical therapist, and I had my kids before I really joined this pelvic floor specialty. That's actually why I got into it, because I struggled in postpartum. So I transitioned from being an orthopedic regular sports PT to doing pelvic floor. So yeah, you're going to learn a lot of goodies that you might not learn in the hospital-based classes. So yeah, I had two kids. I had a kid in 2016, a kid in 2017. After that first birth, you know, I'm a PT. I thought I was good. I thought, hey, I know how to strengthen my core. I know how to do exercises right. I think I'm going to be good. And I was not good. I had all of this pain that just like wasn't going away. I had my colleagues work on me. I was super frustrated. A lot of like low back, pelvic pain, you know, didn't really feel comfortable with intimacy and intercourse. And so I thought, you know, maybe I should go check out one of these pelvic floor courses and figure out what this is about. Because to be honest with you, in school, I didn't learn anything about the pelvic floor, which is really sad. When I went to PT school like 13, 15 years ago, they kind of cut out this whole part of the body. So, but I was blown away. Like I went to that first course and they found where my back pain was coming from. So they pushed on certain muscles that were deep in my pelvic floor on one of the deeper layers, right inside here. And then it kind of shot up my back. So I thought, oh my gosh, I'm having this back pain and it's actually coming from my pelvic floor. Like this is kind of wild. So I thought, okay, I got to dive into this pelvic floor stuff a lot more. And I really want to help other women who are out there and just like, you know, don't have this knowledge and need to get better and they're not getting better. So I had another kid the year after that. After that kiddo, I had a lot more like bladder leakage. I had a pelvic organ prolapse. I just like wasn't feeling good in my body for about like 18 months. And so, yeah, just kind of kept taking more courses and really joined this specialty and really, really excited to share this information with you guys. So I lived abroad for a while, came back. After I came back here, I just wanted to start my own business. So here we are, 2 years later. Our 2-year anniversary will be in May. So we love to help anyone with pelvic floor. So yeah, why do we want to do like a birth prep like course? Like isn't our body just supposed to like know exactly what to do? So you know, I think knowledge is power, and it's really, really important to understand the process and understand the things you can do now in your body that can help have a safer birth, more successful birth, feel less likely to tear, and then feel good going into postpartum as well, right? So yeah, let's build up some confidence. Let's reduce those fears about childbirth. Actually, since we're a small group, let's go around and do introductions too, and we'll just say our name, maybe like if you feel comfortable sharing how many weeks you are, if you're having like a boy or a girl, maybe where you're delivering or how you're delivering. So yeah, Emily's gonna speak as well, so I'll let you introduce yourself. Yeah.
I'm not currently pregnant, but I'm happy to be here. I am a birth doula and I also teach hypnobirthing. And so one of the reasons I love coming here and helping other people is just giving some of those tidbits that, again, maybe we're not getting in other courses. I've taught hospital courses and I've taught other courses, and I realized like, yeah, that curriculum is missing a good part of part of things of how to stay comfortable throughout labor, different tools, you know, whether you want an epidural or other pain medication or not. At some point, we're probably going to be unmedicated. And so it's helpful to kind of just build confidence, build some skills so that we can breathe comfortable or stay as comfortable as possible until maybe we want some of those things. I'm trying to think if there's anything else. I've been a birth doula for about 3 years now. And the last birth I was a part of was actually my 160th. So I'm very excited to share some information a little bit later on moving through labor. So
Yeah.
Yeah.
You want to go next?
I'm Rachel. I'm 35 weeks pregnant. You don't know what's in here. We're going to be surprised. I'm delivering at Rose. I have a birth doula.
Awesome.
I'm reading the hypnobirthing.
I love it.
I'd love to try to do it unmedicated because I'm a masochist. So.
Amazing.
I'm Erin. I'm 22 weeks. I'm having a girl and giving birth at, I think it's called Avista in Louisville.
Yeah.
Mm-hmm. Great. Welcome.
I'm Taylor. I'm 19 weeks. And we don't know what we're having here at Lovely Surprise.
Amazing.
And I'm delivering at Lutheran. And my plan is we really want to do minimal interventions, no epidurals. So
Cool.
trying to
Yeah. Awesome. Mhm.
I'm Elizabeth. I'm 27 weeks pregnant with a boy. Delivering at Lutheran. That's it. I'm planning on getting an epidural, but I mean, I don't know.
Yeah.
This is my first class, so
Cool.
time to get educated so I can have all the information.
Yeah. Is this your guys' first child and everything? Yeah. Newbies. Yeah. Okay. Yay. Thanks for coming. So I'm going to talk a little bit about, I love to talk about anatomy. So I'm going to share a little bit about anatomy and how it relates to problems in the pelvic floor. What are some things to look out for in pregnancy? A couple of you guys are a little bit farther along than the other ones, but things change. People, one week you're doing great. The next week you're hobbling around and wondering where this pain is coming from in your SI joint. So things can pop up fast, and it's important to know where to get help for some of these things, or just some easy things you can do to just give yourself a little bit of relief too. But no, we are always here to help if stuff pops up for you. Yeah, I'm going to talk a little bit more about some birth prep exercises and stretches we like to do here. So we're going to get down on the ground and do some of those. Some different positioning things during labor. And then what else am I talking about? A little bit about pushing, a little bit about early postpartum recovery, and then I'll let Emily talk about all her doula and hypnobirthing practices after that. So here's your pelvis. Everybody has a pelvic floor. I'm not kidding you. Where almost every workshop I do a lot of workshops for gyms and church groups. A lot of times they ask me, do men have a pelvic floor? I know women do, because a lot of women can have pelvic floor issues, but yes, everyone has a pelvic floor. Your pelvic floor is not just one muscle. It's a group of muscles. It's about 30 muscles, and there's layers. So we are housed here by the two pelvic bones. The bony parts right here are what you can feel on the front of your pelvis. These are your sit bones right here. Your pubic bone in the front with the pubic symphysis joint. That joint sometimes acts up a little bit in pregnancy. You might have heard of lightning crotch. So that's the one. That's where it comes from. And then on the back, we have the spine coming down, so the different vertebrae, L4, L5. We have the sacrum here and the tailbone. The two SI joints are joined by the sacrum and the pelvis bones here, okay? So that's the bony structures. Anything you see in red is a pelvic floor muscle. So like I said, it's a group of muscles. It's not just one. When someone comes in here with a pelvic floor problem, we're trying to figure out who's the culprit, who's the bad guy in here, what's going on. It could be some of these outside muscles. These guys are more of our closer muscles, closing around the urethra, around the vaginal canal, around the anus, right? So they open and close around the openings. Our deeper layers are more our lifter, supporter muscles. So these guys hold our bladder, our uterus, and the rectum inside. So help support that. The pelvic floor works actually like a trampoline. So it helps absorb shock in your body. So the function of the pelvic floor is not just to squeeze and open, okay? It's to support your organs and also support the weight of your whole body. In pregnancy, we get a lot more tension that goes through this guy because you're gaining weight, your body is changing and shifting, so like your pelvis is rotating forward a little bit to help offset that belly that's growing. So the pelvic floor has to work really, really hard in pregnancy. And so, yes, we want to strengthen the pelvic floor, and we'll talk a little bit about that, why that's important in pregnancy. But it's also going to be important to lengthen the pelvic floor, and we'll talk about that as well. All right. So I will say, okay, if we're going back to this trampoline thought, the pelvic floor needs to absorb the shock and the load, right? Has anyone here yet experienced a little bit of bladder leaks or peeing from a cough or a sneeze? It's happened? Yeah. It happens in pregnancy quite often. So many women report that because, that pelvic floor is having to work hard to support those internal organs and that load. So like we said, a lot of tension is going through that pelvic floor. So if you think about a trampoline that doesn't have a lot of give to it, it's pulled really, really tautly. If you go to cough or laugh or sneeze or jump, your bladder lives right on top of your pelvic floor here. So if you think about a hard, firm pelvic floor and all that pressure and that weight of the baby and all the stuff is coming down on that bladder, well, the bladder should, or the pelvic floor should lengthen and stretch to allow for that cough to kind of be absorbed in your body. But in pregnancy, maybe not so much. And the bladder's getting kind of shoved against that firmer, tighter pelvic floor, and then the leaking occurs. So that's why a pelvic floor might be tight and we want to lengthen it, okay? The other thing that can happen along with this in terms of that loss of urine with the cough, the laugh, or the sneeze, if we're trying to contract the pelvic floor and our pelvic floor is tight, the pelvic floor is like my biceps here, and it's only going from here to here. And I'm trying to engage and contract it as I'm coughing. I don't generate much force if I'm going from here to here. But if I had a lengthened pelvic floor and I go to contract it right before that cough or sneeze, I would have more force. So it'd be stronger if it was actually lengthened, right? So who here, was anyone told just to do some Kegels while they're pregnant or anything like that? By the doctor, just kind of heard that on social media, anything? Yeah, you're I don't know. Yeah. Somebody's mentioned Kegels, yeah. Well, it's popular, that's all really people know about the pelvic floor, right? Is, okay, I should squeeze and relax, squeeze and relax, squeeze and relax. But if in pregnancy you had this pelvic floor that was super duper tight and you're just squeezing and squeezing and squeezing, you might over tighten the pelvic floor, and that probably won't help your bladder leakage, right? So if we're just told to squeeze, 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 we're gonna just perpetuate the problem that's already there. And then your baby's gonna get bigger. You're I'm still peeing my pants. And the sad part is sometimes my pregnant mamas are told, you're just gonna have to wait till you give birth and the peeing will go away. And that is absolutely not true. We can help people with bladder leakage while they're still pregnant, get it better, or at least somewhat improved before they give birth. And then it's gonna get a lot better in postpartum, and we can help you fully recover from that too. So there is hope for you if you start to get bigger, you start to pee, you can get some help with that, and it can get better before you give birth, okay? So the biggest part of the pelvic floor, honestly, that we see in pregnancy is people, are too tight, and there's a lot of tension going through it, or they're tight and weak. I don't really ever see a pregnant person with a pelvic floor that's just weak. There's usually a lot of tension going through it. and they're like over Kegling, and we're having to kind of re-educate and set them on a little bit better course, okay? Just to kind of go over some other pelvic floor symptoms you might have that maybe you don't know are pelvic floor related or pregnancy related. So obviously bladder leakage is a huge one. Pain with coughing, laughing, or sneezing is called stress incontinence. There's also urge incontinence. Urge incontinence is like you're driving home, you're like, I have to pee, but I think I can make it. Then you get out of your car and you walk in your house, and like the urgency just hits you really fast, and then you pee or feel like you're peeing as you're like pulling your pants down. So urge incontinence is something that happens as like sometimes like a behavioral thing that happens is like we're always peeing just in case. Our bladder got used to always sending us that signal that we have to go. So we have to change the behavior, but also usually that pelvic floor is also too tight and we need to create better space and length. If you have urge incontinence and your pelvic floor is too tight, your bladder might only be filled like a quarter full, and that tight pelvic floor is pushing on it, and it's telling your brain, she's got a full bladder, she has to pee. When really you don't, because your pelvic floor is just pushing on the bladder. That makes sense. So that's why we want a nice, flexible pelvic floor with those incontinence problems. We start to see bowel issues. So again, with a lot of tension in this pelvic floor, this is where the anus is. You'll see there's a lot of red around that guy. So a lot of pelvic floor. This pelvic floor goes all the way to the sacrum and the tailbone, okay? So if you have a really tight pelvic floor, you might not be pooping as well as you'd like, okay? I know hemorrhoids are a big issue in pregnancy as well, just a lot of pressure in this area. So definitely that's usually a pelvic floor problem that we can help you create more space in this area to relax so you can poop better, and that so you don't get hemorrhoids too, okay?
Andrea, is that like constipation kind of related things too?
Yeah, constipation. Yeah, so constipation can be obviously like diet related or hydration related. A lot of times if we're having trouble eliminating, it's a tight pelvic floor and maybe poor pelvic floor mechanics. Maybe they're accidentally squeezing their pelvic floor when they should be learning how to bulge and bear down and let go, okay? Joint problems, so pubic symphysis pain, that lightning crotch pain, that's usually pretty sharp right in the front of your pubic bone. If you've ever experienced that, it's really not that fun. But we can create treatment plan around that, lengthen any tissues that are tight and strengthen up tissues that attach to this pubis area. SI joint pain, so usually like it's one-sided at a time. Pain in that butt area. A lot of people will come in and say like, I have sciatica or something like that. I'm like, oh, I think it's your SI joint because you're not, a lot of load has to go through this SI joint. So all the weight coming down your spine has to be dispersed through your legs. And guess all that force has to go through those joints. So in pregnancy, a lot of things get wider, get a little bit looser. So it's just a little bit harder to keep that stability. But we can give you good exercises to make sure you're nice and stable in there. Back and hip pain, super common as well, just from all those body structural changes. Like in my case, my back pain was actually part of my pelvic floor too, so that don't discount, like if you're having back pain, it's just in your back, could be in your pelvic floor as well. And there's pelvic floor muscles that come out and attach to the hip joint too on the side. So they kind of come out back here. So hip pain can be related to pelvic floor pain as well. So the more you know. Round ligament pain we see quite often. So the uterus is obviously a lot bigger. And those round ligaments come off the uterus and they come down. The round ligaments actually attach to the labia down here. And so we work to make sure someone's belly is nice and balanced, not too tight on one side with the round ligament, and we can work on releasing that and making sure their abs are working the right way. So those are the common issues. Any questions before I move on? Like, is this a pelvic floor problem? Is this anything you want to ask real quick? We'll do some Q&A at the end as well.
Why is the SI pain only one-sided? I think I might have that, like my right side of my lower back is just
Always there, yeah. I will say that sometimes it switches too, side to side. It's just because we typically see that pain when one side of the body is loaded more than the other. So maybe you're loading that side a lot, maybe how you're standing, could be like other environmental factors, maybe how you're sitting too. So it typically is one-sided. And then, but yeah, and some people, it's like the right side 1 week and maybe it moves over to the left side, but typically it's like staying pretty angry on one side. And the sides don't look similar. And what I mean by that is sometimes one side is really stiff and tight, like I can't really move through this joint very well if I push on it. And the other side might be super loose too. So we're just treating what we find in terms of like stiffness and weakness. So yeah, good question. But yeah, it's typically one-sided. Yeah, so a lot of these issues are related to either the pelvic floor being too tight, we need to lengthen it. So we're gonna go over that next to learn how to like fully relax the pelvic floor. Because the pelvic floor has to basically get out of the way and move out of the way for that baby to be delivered safely. Another question I get a lot is, oh, I need to Kegel to get my baby out, which isn't really true. We actually need that bottom of the pelvis to stretch and open and relax so the pelvic floor can actually get out of the way. The uterus is what contracts to get the baby out. Pelvic floor just needs to stretch. So we need flexibility of that pelvic floor is really important towards the end. Okay. So first thing on my list is perineum stretching too. Let me keep this. So the perineum is this, basically all that tissue between your vaginal opening and your anus. If you're gonna tear, it's usually in this area. There's different grades of tears. There's small tears that are just maybe on the outside, and there's unfortunately really bad tears, which are the tears from your vaginal canal all the way to your butthole and opening that up. So those are not fun. So I'm going to teach you some things you can do for stretching to help reduce those tears. Research tells us if we do this perineum massage, we're less likely to get the really bad tears. And the research also said like there's a chance you could still get the smaller tears. Those are okay. They heal up nicely. We just don't want the really bad ones that require surgery. Okay. We have this device here that's called a pelvic wand. It kind of looks like a little snake. I love pelvic wands, and they're really nice to have in pregnancy to reach that perineum area to help you stretch. Okay. So I have some handouts for you guys too before you go. It talks about perineum massage, but it's just a way to gently insert the wand into about to the tip there. And we're stretching in different directions. So we're pulling straight down, maybe off to the right and off to the left, and even swooping back and forth to create flexibility in this area to not tear. I also teach this with my thumb. So sometimes I'm like, I don't want to get this wand out. You can also do it with your hand, okay, with your thumb or your fingers, even in the shower when you're naked. So I teach all the different ways you can do that to help stretch your perineum. So the only reason you might not want to do this is if you have any active infections or your provider says, hey, you're on pelvic rest. Don't touch anything down there if there's something going on with the baby. But other than that, if you're okay to be sexually active, you can do perineum massage and stretching. That's great. Please do it anytime. So that's perineum massage. Now we're going to talk about breathing. So if there's one thing I want you guys to remember from this too, is to remember how to diaphragm breathe. The diaphragm is kind of like the roof of this whole abdominal cavity. So you have the diaphragm up here right under your rib cage, right? Probably getting hard to breathe for some of you guys because that baby's already pushing on the diaphragm. And then the pelvic floor is like the basement of that. So if we have good ability to diaphragm breathe, guess what? That diaphragm is actually like a secret pump inside your body too that can help assist the uterus with encouraging that baby to have movement and flexibility, head down, okay? So we're gonna do diaphragm breathing. Let's do it in the chair first, and then anyone that's comfortable like lying on their back on the mat, let's do that. Or I can show you some other positions too if you're not comfortable lying on your back. So let's just sit up tall and let's put our hands on our ribs here. So try to put your feet flat on the ground. Awesome. So your diaphragm, right, is that umbrella muscle right under your rib cage. With diaphragm breathing, people tend to think it's just the belly getting pushed in and out, and it shouldn't be. It should be your ribs moving wide. So think about your rib cage expanding like a balloon inside you, all different directions, okay? So if you watch me, I have my hands on my ribs. I'm going to inhale. My ribs go wide, and then exhale. My ribs come back together. Good. Let's breathe together. Breathe in. And exhale. Good. You should think about your breath coming into your abdomen, not up in your chest. So I don't want you to, have the breath coming up. Really think about belly staying soft, pelvic floor staying soft. Don't clench anything down here when you do this. Think about I like to think about breathing into all the way into my butt too. Breathing in and letting that fully relax. Okay. Let's move into some different stretches with the diaphragm breathing so we can practice that in different ways. Excuse me. If you're comfortable lying on your back, go ahead and lie on your back. If you don't want to lie on your back, get into child's pose. So toes to touch, knees wide. So go ahead and bend your knees. Just lay out, yeah, knees up. And then put your hands back on your ribs there. Perfect. And then really let's take 5 breaths together, breathing in, feeling those ribs go wide, and then exhaling. I don't want any pelvic floor squeezing. I just want you to think rib cage wide. If you're in child's pose, really think about breathing into your back of your rib cage too. That's really awesome. We're usually really tight in the back of our rib cage in pregnancy because everything spills forward into the tummy. So to even think about breathing into your back is fantastic. Good. Does anyone feel like my ribs are moving? I'm stuck. Everyone feel like you can feel your ribs moving? Good. Yeah, you guys look like you're moving good. Definitely this gets harder as you get bigger, right? So the more you can do it early on, it's great. Just getting that flexibility in there early on is key. Diaphragm breathing will calm your nervous system. If you're getting to the hospital or birth center and you're kind of starting to freak out, just kind of coming back to this diaphragm breathing, don't even worry about what's going on in the contraction. If it's just too overwhelming, just think about that diaphragm breathing to kind of center yourself and try to calm yourself down, okay? Good. Let's get into, so we're gonna do a couple other stretches here with the breath work. Let's get on hands and knees now. So a lot of it's a lot of yoga-based movement, okay? So cat-cow is one of my favorites to not only help the spine move better, because if your spine's stiff, it's gonna be harder for baby to get out the right way too. With the breath, we're going to inhale for cow pose. So inhale to drop your tummy, look up. Try to let your belly fully relax here on the inhale breath. And then exhale, curve your spine, tuck your head, tuck your tail. Good. Let's do 5 together. Breathe in into your tummy. Our pelvic floor should be nice and soft here naturally. And then exhaling, rounding your spine. The pelvic floor lifts just a little bit here, and it's not like you're actively squeezing. It's just kind of the nature of your pelvis tilting. Good. Keep going. Has anyone gone to prenatal yoga? No?
I'm kind of surprised.
Really? Okay. I loved my prenatal yoga classes. I had my kids in 2016 and 2017. There was nothing around here. I drove down to Belly Bliss in Cherry Creek. Yeah. I would love to offer one here. I just need to find a yoga teacher. And it's just another thing on my list I've been wanting to do. So
I think
yeah, it's hard. Yeah.
Ohana yoga on Tennyson is pretty good for Ohana yoga.
Mm-hmm.
Yeah, on Tennyson is pretty good for prenatal. They're not in person?
Yeah.
That feels rude almost, like.
It is rude.
That is rude.
Why?
Yeah.
I'm trying
Okay.
to think of like another class, but I'll find one and send some to you.
Yeah. Yeah. But yeah, Arvada is a little limiting for that, unfortunately. So if I find a yoga teacher, I'll let you guys know, but maybe you already have your kids by now. So breathing with the cat cow is important. To inhale for cow pose, exhale for cat. Like do that every day. It's just amazing for your pelvis and your spine. I love to do a puppy pose. So what I call a puppy pose, I'm getting on my elbows and knees here. I'm resting my head fully on the ground. And I'm also putting my feet a little wider than my yoga mat, okay? If your knees and hips allow that for you, it's gonna be awesome for stretching your pelvic floor. When your feet are wider than your knees, it's called hip internal rotation. When we're internally rotated, the bottom of the pelvis opens more, okay? So this is an awesome stretch, and let's take 5 breaths here, okay? So let's breathe in. Sometimes if this doesn't feel that great, like try to really fully rest your head. You can kind of support your head on your hands too if you want to. You could shove some pillows under your tummy. This pose is nice too for getting any like swelling out of your pelvic floor and vulva area. When you're pregnant, your vulva, your labia gets really swollen because of all that lovely blood flow in this area. And this one's a nice one for like getting some of that blood out of there, some of that swelling. So yeah, you're still thinking about that diaphragm breathing into your back, into your rib cage. If someone says like their hips or their knees really hurt with this, you can definitely, try a child's pose stretch as well. Cool. Yeah, you can come on up. Let me show you real quick with the pelvis. So this is my movable pelvis. When we go into that position with our feet a little wider than our knees, my hips are turned internally. Oh my gosh, my dog hair all over me. So when my hips are turned internally, my pelvis does this. My pelvis does this. So it gets a little bit wider on the bottom, which is super awesome for baby exiting the pelvis. I think this would be a good transition, into what I talk about next with the pelvis. So pelvis is going to move a little bit during labor as baby is descending down. So here's my little baby. As we're entering that pelvis and getting down in there, we want the top part of the pelvis to open wider. So that's going to be good for pelvic or hip external rotation with our knees wide, feet wide positions. So what that might look like a deep squat with our knees wide, okay, and hip external rotation. That might look like a child's pose stretch, knees wide, toes to touch, external rotation. Those are kind of some of the good ones to get that opening of the top part of the pelvis. As baby gets down towards the middle, we like to do things that are like shifty exercises. So that might be weight shifting back and forth, okay? That might look like maybe if there's a step at your house.
Like this,
you might
a nice little
a little
Captain
shifty
Morgan
on a step. Yeah, Captain Morgan. You could even like go up and down like you're walking on a curb, standing up and down. Yeah. That might look like if you want to sit on that stability ball.
Get some of these.
Maybe some circles, maybe some pelvic tilt side to side. So those are nice for like getting baby to get nestled down into the pelvis. And then to get out are those hip internal rotation movements. That puppy pose. I'm going to segue into a couple other hip stretches. I'm going to have Bree, you want to be my model too? Let me grab a yoga mat. Put it right here. So this next one is hip 90-90. You're going to get hip internal and external rotation with this. So everyone, you can face the mirror, or you can just face that way, yeah. And have your right leg in front with the thigh bit and your left leg out to the side like this. It's kind of like a mermaid pose. You're like sitting on your pelvis. Yeah. Okay. So you see my front leg is in external rotation. My back leg is in internal rotation here. Okay. I'm going to go ahead and sit on my sit bones and then switch it to the other side. Excuse me, too. So I'm going to go kind of back and forth, and I can kind of lean forward a little bit to feel a little bit more stretch in that front leg. And I can weave back and forth. You know, this might not be, you might not be doing this in active labor. This is more of like a good stretch to do during your pregnancy, is to make sure both hips are moving and grooving like this. And pay attention to your hips. Is one, oh my gosh, this one feels really tight when I go this way. And tune into that and maybe work on that a little bit more too. You can take it up a notch, and with the back leg, you can lift the foot off the ground. That's going to provide a little bit extra hip internal rotation, and even work to strengthen that hip into internal rotation too. So just another variation you can add with that as well. Yeah. I'm going to have Bree demonstrate the peanut ball here too. Peanut balls are really nice for labor, but they're also kind of fun for home too, to like just get out of painful positions. Go ahead and straighten your bottom knee a little more. See that, and then kind of put your top leg on here too. So if this feels really nice to you, you might want to consider getting it too, but like it can be like a little partner assisted movement here. Just encourage that shiftiness when you're in that middle stage of labor too. Get some movement in there.
This is a great thing to do if you have an epidural as well and you still want to be moving. I know a lot of people, part of the reason they don't want an epidural is because they want to be up or active, and this is a great thing to get movement in if you need it. So
yeah. And then you can also do a little hip internal rotation here. You can have like a partner help you just kind of stretch and open up the bottom of the pelvis. And you can do it like actively on your own too. Yeah. And then you can even just like hang out and rest and relax. Go through some contractions there as well. Okay, good job. Thank you. So yeah, in pelvic physical therapy, we're working on finding where you're stuck, where you're tight, and opening that up so you feel really good and confident going into that birth, right? Any questions about those? There, we need loosey hips, loosey-goosey hips, nice movement in the spine, so the pelvic floor is nice and flexible. Another thing I always love to make sure is that in pregnancy, your abs are going to stretch a lot. You know, we can have that diastasis recti happen. Well, it's going to happen no matter what. If you're pregnant, especially in your third trimester, everybody has that separation. So there's nothing really you can do to prevent the separation. But what you can work on is how strong the muscles are. So I want to make sure you guys are doing a good ab contraction on a hands and knees position. I call it hug the baby. And you can build off on lots of different exercises from that, but to make sure you have the foundation of that hug the baby exercise, you can, work on that through pregnancy. It's going to lead to better outcomes in postpartum too. So the people that prevented that big gap in postpartum that never closed, those people had good abs that prevented that. So let's get on hands and knees. And there's extra blankets if your knees don't feel good. You can kneel on a blanket. So your spine's gonna stay nice and still, okay? You're not gonna move your spine. You're going to inhale and think about your baby dropping without you moving your spine. So you're gonna inhale and just like let your belly be soft, okay? On the exhale, we're gonna think about zipping up our core. Think about that pubic bone to rib cage zipper happening, feeling that lower abdominal wall tighten up and like you're hugging your baby to your spine, okay? Try to inhale and drop that baby back down again. And then on the exhale, we're lifting baby towards our spine without bending our back, okay? I usually like to go around and check this on everyone. Are you guys okay with that? Okay. Let's start over here. Okay, so you're gonna go ahead and inhale and drop your belly down. And then exhale, yeah, bring baby into your spine. Good. Inhale and drop it again. There you go. Good. And then exhale. Nice. Can you feel that? Good. And yep, whenever you're ready. Nice. And then inhale and drop. Sweet. And exhale. That's it. Awesome. And go ahead. Yep. Inhale to drop. And exhale. Awesome. Okay. Yep. Good. And then exhale, zip. Good. Great. So that's the foundation of making sure your transverse abs, your deep abs are doing their job. Okay. We can build upon that with, you can still do plank exercises as long as your abs are working well. You know, bird dogs. There's so many different ab exercises out there. I still sometimes have women in pregnancy work on modified crunches too. If you're doing it right, in my opinion, and what the research says, there's really no risk unless you have blood pressure issues. So we're always monitoring to make sure you're doing the ab exercises that are appropriate for you too, because no two people are alike. Okay. Sweet. I'll probably, do we want to do questions at the end? Or do you guys have some questions now that?
Yeah, I was going to say, if you had some questions now, I could also kind of cater to some of the other things that we talked about.
Yeah, because I'll probably let you go into now. Oh, yeah.
One question. I haven't had any pain until 2 days ago. If I sit for too long in my office chair, there's deep in my inner thigh for 10 steps. It's I forgot how to walk, and then it goes away.
Yeah, on the thigh, as it connects to the pelvis.
Yeah.
It's your adductor muscle in there.
Yeah, very.
Yeah. Definitely something that, you're definitely not alone in that. The adductors connect right here and here and blend in with the pelvic floor. So again, that pelvic floor is getting a little loaded up right now as you're getting bigger. And the adductor is probably trying to help that pelvic floor out. But we can stretch and move through the adductors. Why don't I teach you a really great adductor stretch? Let me teach you my favorite one. So this is, that's one of my favorites in pregnancy. So why don't you guys try it on hands and knees and go ahead and stick one leg out to the side. You might already feel a stretch just in this position, but if we rock back, bend that knee, and you'll feel even more inner thigh stretch there as we just rock forward and back. Again, just another great daily stretch to make sure we're getting flexibility in this adductor area because it attaches to the pelvic floor. Super important to keep that moving. Yeah, I love that one. It's a good one. And you can breathe with it, relax your pelvic floor. I'm going to let you talk more about pushing. Okay. Because I think you've covered that, right? And then, so let's say, okay, I have the baby. What do I do? What's next? Day one. What's going on here? The way, postpartum recovery is in America, it's not the best. I feel like a lot of women don't get the good education leading up to birth and even in early postpartum. But main things I want to say is the essentials are important too, with hydration, rest, nutrition, and just bonding with your baby. Some people ask me what should I do day one? I'm just breathe, try to get into that diaphragm breathing again, and just really focus on what your needs are in terms of nutrition, hydration, rest. It's super important. Don't be focused on getting your abs back day one. After a couple days, maybe a week, you can start to do like a gentle ab zipper if that feels okay for you too. Again, if you forget to do it, that's okay. You're gonna be able to work on that. There's plenty of time. So like the top 3 things I would say to do in early postpartum are just diaphragm breathe again, get that diaphragm to move. It's gonna help your rib cage close better too, because that rib cage is gonna be kind of spread out from the baby pushing it out. Breathe in your rib cage, start those little ab zippers, contract your abs again, and start to move your spine. Your back is pretty stiff in terms of rotation. So simple rotation stretches, that might look like just stretching on your side, opening up like an open book stretch, right? Yeah, something simple like that is great. So the big no-nos are, really no intimacy until we've spoken to the doctor, cleared you for any like stitches, things like that. We start pelvic floor checks at 6 weeks. Sometimes people come in earlier. I've had girls come in at like 10 days because they couldn't walk. They had some stuff going on with their pelvis. So I had to come in and work on, I do a lot of closing of the pelvis movements to help support that closure. It's going to help you heal faster. So sometimes people come in early just because they're in a lot of pain, and I'm just working on closing their pelvis and getting their muscles to turn on. Sometimes people come in at like 4 weeks because they're ready to go on their abs and they want to do something. I'm like, great. Sometimes people come in at 6 or 8 weeks. Sometimes people come in at 3 months. It's just like everyone's journey is a little bit different. Is anyone having like a planned C-section? Not right now? Okay, cool. What else? Yeah, so those are like the main things with early postpartum recovery, but like, yeah, let us help you heal it fast. And we love to, see mamas thrive and feel better in your body. Cause a lot of people we're busy with the baby, we're busy with our families. It's hard to take care of ourselves. So make the time, take care of yourself too. So I'm gonna turn it over to Emily.
Awesome.
And we'll do a little Q&A at the end.
I'll bring just some of my notes up here. I am curious before we begin, I'm looking at our 2 who are a little bit more pregnant than the center. What have maybe been some tools that you guys have heard of or are planning to use during labor or anything like that in terms of like comfort or pain management? I don't know, anything. Or anybody, this is a question for anyone, but.
A lot of breath work.
Okay, awesome.
I think like trying not to be terrified.
Okay, that's a big one. Yeah, we'll talk about that more in a second. What about y'all 3?
I think the ball for sure. I want to be able to just like move as much as I can.
Okay.
I guess distraction and stretching and breathing. Just I don't know. I've seen a lot of like stretching with my partner too. With like hip pressure and things like that.
Awesome. I was definitely going to go over some counter pressures here that will hopefully teach all of our partners or doulas or whoever might be supporting you that day. Okay, awesome. What about you 2? Have you guys thought about that or still a little early to?
I've seen a lot about just movement and being able to do what feels comfortable and be in what position you want to be in.
Awesome. Wonderful. Anything you want to add on top of those? This spoke for you. Awesome. Well, I wanted to cover a couple of things of just like how can we stay more comfortable in our body, some breathing techniques that allow that, and also movement. But kind of going back to what you had mentioned earlier, fear is a huge thing. Andrea had mentioned it too about certain breathing techniques can actually help us feel safer in our body. We know that when we get into this fight or flight mode, where does our blood flow go? It goes to our extremities so we can run, so we can, get out of there. What happens, I guess, like fortunately, unfortunately for us, our uterus isn't going to save us in an emergency. So when we start breathing up in our chest and we're like, I'm getting panicky, my voice is going a little higher, I'm starting to scream maybe in a contraction. Where's our blood flow? Everywhere else except for our uterus, and that can also cause more pain. So it's kind of this fear, tension, pain cycle that we talk about, FTP. As we're breathing through contraction, maybe we get nervous. What do people start to do? We start to tense up our shoulder. When we're tensing up our shoulder, sometimes we're tensing up our jaw. We have this wonderful jaw pelvic floor connection too. So if you squeeze your jaw, you're squeezing these muscles, and really all these muscles need to be doing, like Andrea was saying, is relaxing. So one of probably the 2 or 3 biggest cues that I give to women in labor during a contraction: loosen your jaw, try and drop it low. It just made me think of something else. For your partners, I'm sure for your benefit too, try and give them some words to say other than relax, because I'm sure no one wants to hear, just relax, relax. And you're like, I'm breathing and I'm trying to relax. So jaw heavy, loose, limp, things like that. Another one is like our foreheads will squish up. And again, when we're squishing our face like that, we're squeezing everything. So loosen up that forehead. One of the breathing practices we'll try here in a moment, the first thing I want you to do is with that exhale, drop everything. So every time we're having a contraction, and I'm gonna go like this and make a little wave, because our contraction is the squeezing of our uterus, pushing our baby lower and down, and it gets to this peak where it's like the most tense, the tightest your belly has ever felt, and then it relaxes and releases. And then you have this beautiful, 2 to 3, 3 to 5 minutes of rest, and then you have that another one where it's gonna squeeze and get intense and then release again. They keep doing that, and they're gonna get longer, stronger, and closer together. So a couple of the things that I like to bring up there too is that we can do anything for a minute. We can do anything for about maybe 2 minutes at the max is the longest a contraction might be. So when we practice some of these breathing techniques here in a moment, I really want you to think like, how many breaths might it take me for 1 minute? Because sometimes getting through a contraction, it's like, I have 3 breaths. I just need to count into 4, maybe that's it, and let out to 4. So kind of keeping some of these things in mind are little tricks, little tools to keep us engaged and keep us focused. One of the ways that I like to describe labor is like it's the biggest HIIT workout that you might ever have, and the biggest like mental focus. If you've ever been in a meditation for 5 minutes and you're like, my brain is going into my grocery list, my brain is going into something else. Labor takes all of your focus and all of your energy in that moment. It's like full concentration mode. So if we can do that for a minute and then we can relax and release everything in between, we're going to be much comfortable longer on in labor. Same thing, kind of going back to that fear section. A lot of times when we're nervous, maybe I'm going to talk about a couple other positions, but like forward leaning positions tend to be super comfortable for women in labor. We tend to see like people getting nervous, pulling up one ankle, pulling up the other, and that's not helping us get this movement or even relaxing our body. I really want to see people kind of like, really shaking their hips, really trying to sway back and forth in whatever movement or position they're in, and that's going to help you kind of work through those contractions better too. Because another way to think about a contraction is, has everybody been to the ocean? Hopefully, we've seen it maybe. These waves come in. We can think of our contractions as big energy waves. If you put your feet, bury it into the sand, and brace yourself like this for that wave, it's gonna knock you on your feet. You're gonna be like rolling in the sand later on. Versus if you can get your body loose and limp and be floating with those waves, you can ride that energy easier. So it's the same thing with contractions. You try and stay loose as limp, feel like you're almost like a jellyfish in those moments. I promise it will maybe make more sense after you've been through labor and you're like, okay, yeah, I get it. Like when I tensed for a contraction, that was intense, versus if I could kind of stay loosey-goosey, like you were mentioning earlier too with that. Before I jump into maybe some more like comfort measures, any specific questions that we have on labor, like the stages of labor, anything like that? No?
At what point do you go to the hospital?
Great question. Spontaneously, yeah. So Most of your providers will give you a code. It's usually 511, 411, or 311. And what this stands for is how fast your contractions are coming, how long they're lasting, and how long this pattern has been going on for. So 511, you're having a contraction every 5 minutes. That contraction is lasting 1 minute, and that pattern has been happening for about an hour. You know, if you're going to the hospital and you're at that 511, you probably still have like potentially 3 to maybe 10 hours of labor, maybe more, maybe less. It's such a vague kind of line there. I'm sure you're getting a lot of vague answers, like that's normal, and also the other end of the spectrum is normal. I suggest for people who definitely know that they don't want an epidural or trying to go more unmedicated, is staying at home longer. Thinking about our mammal cousins, you know, none of them take a childbirth class, and yet all of them give birth. You know, they're not as nervous about it because, you know, they might not know it's happening. But what do these mammals do in labor? They go to low stimulus environment. Like these lights would probably be a little too bright. You know, turn that energy down. Stay in your den, this nest kind of homey environment. And so staying in that longer is going to help you stay comfortable for more of it, and then also reduces some of the interventions that you could potentially have at the hospital. Things to consider though, if you're coming in at 311, contractions are every 3 minutes, it's lasting 1 minute, and that pattern has been going on for 1 hour. You know, depending on whatever your drives are to the hospital, you might have 15 contractions in the car where you're sitting in kind of like an awkward position, versus, you know, that 511, you might be more comfortable as you get there. So there's some toss-ups. I've had a lot of women get to the hospital around that 311, and like the hospital staff are like, we need to get this woman into a room now, versus 511, you might be going to triage room for a couple of hours first and then get admitted into a labor room. So just some things to think of. Where was I going with that? Other questions about labor or that timing, that time frame?
When is it too late to get an epidural?
That is a great question to potentially pose to your doctors, just in case. I've worked with women who fully dilated 10 centimeters. We started pushing and pushed for like an hour and then got an epidural. So that's very close to meeting your baby. If you feel your baby in your vagina, that's probably too late. That means that your baby is a little bit too low. And some things to consider too is that with an epidural, the closer you are to giving birth, the less strength it might have. So it might take a bigger dose of medication to really cover you. And the things to kind of think about with an epidural too is that it doesn't take away everything. You know, if you're at a 7 out of 10 pain, it might get you to like a 2 or 3. And that's a good epidural. For some people, it takes away everything, and we love that. But even if it's just a little bit less, that epidural is still working.
I had one of each, and like I waited too long. I didn't get that second one, but I was so close. Like I was 10 minutes away. So I don't know. I was like, I think I can do it. And then like I got to that peak of pain and then asked for it. And then they're like, well, he's about to come out. So
we can see his head.
Yeah. So I did, I guess I was aiming for that unmedicated birth too, but then, you know, you kind of things change, and you're like, well, I just want to see if it's still an option. And he came like 10 minutes later. So
yeah,
that worked out. Yeah.
Yeah. It's something to consider, because some people are like, let me go like the last possible moment. And sometimes they might be pushing it a little too far. But generally, when you do get an epidural, you may have seen videos about this. I'll just use this, well, maybe not that well. To get an epidural, you have to stay in this kind of curled position. You're almost like you're kissing your baby belly. And so part of the waiting very long as well is that sitting in this position every 3 minutes having a contraction, that's hard. That could be tough, and it maybe takes 5 to 15 minutes to get an epidural, depending on a lot of different scenarios. So good things to kind of keep in mind. Mm-hmm. I was just going to briefly go over the stages of labor and some comfort tools that might be helpful throughout each one. Does that sound good? And then we, of course, can jump into any questions. I can't remember when we were planning on wrapping up, but we'll keep going.
Like 7:45-ish.
Okay, cool. So at the beginning of labor, labor can start a lot of different ways. Sometimes it's really patterned, but other times it's kind of maybe more sporadic or spontaneous. And that's because nature, not perfect, but she works, she gets things done, whether it's, strict type A kind of thing or type B, C, whatever. So labor begins and you get this cramping sensation. Sometimes it starts with almost like a period pain that comes and goes. So maybe you feel that starting and it's like, I felt it at 8, and then another time at like 8:32, I felt this tightening, this squeezing, sometimes some downwards pressure, and then it fades again. And those might last for 30 seconds bursts, and then they're gonna get a little longer. Like I said, max about 2 minutes. Usually they're right around a minute though. Sometimes it can be long. As we move throughout labor, maybe that's been happening for a couple of hours, maybe that happens overnight and you can sleep through it. Labor is going to pick up. In active labor, that's when we're close to that 5 or 4 minutes apart. And I probably should backtrack for a moment as well. When we talk about contractions being 5 minutes apart, it's a little bit of a misnomer because they're happening every 5 minutes. It's lasting for 1 minute, and we have 4 minutes of rest before the next one starts at that minute 5. So we're counting the length of that contraction in that space. But so every 5 or 4 minutes, that's like active labor. The textbook definition means that you're 6 centimeters dilated and above, but every like 4 to 5 minutes, you're working hard, you're active. I'm gonna consider that active labor. That's when a lot of women, you can't be distracted anymore. A lot of times that early labor, you could talk through a contraction. Maybe you're like, ooh, I'm feeling kind of funny, I can't focus. And then you're like, okay, I'm good again. Once we're getting into active labor, this is when we're like, ooh, okay, this is happening. Taking some slow breaths, not able to be distracted through it. That is the best time to actually start timing your contractions. If you start timing them when you're like, oh yeah, I feel like a little something happening, you're gonna be so focused on each contraction from there on out that it's gonna be maybe more intense because you're like honed into that sensation. So try and distract yourself for a little bit longer before maybe getting out that contraction app or whatever app you're using. And then we go into transition, which this is like textbook definition, 7 to 8 centimeters and above. This is usually the most intense part of labor, whereas, that hip squeeze that I was getting before, now I'm like swatting away. Don't touch me. Colorful language tends to come out, like when you've been maybe dancing with your partner and you're like, I love you, and then you're like, get away from me, stop breathing. These are things that I hear frequently from some moms. That's when a lot of these tools, or I'd say active labor and in that transition period is when a lot of tools are being used. So we're going to talk here in a moment, a couple different breathing techniques. So one, we'll kind of jump into the diaphragm breathing in a second, but the first one, I like to call it just calm breathing. This breathing technique is used in therapy. It's used in a lot of different practices to reset the nervous system. So you may have heard it called different things, but the idea is that you're inhaling for about 4 seconds in through your nose. I know that pregnancy rhinitis is a big thing too, so if you have to breathe through your mouth, of course do it. Breathing in through our nose and then breathing out through our mouth to about the count of 8. So what we're doing is we're kind of extending our exhale about double the length of our inhale. So if those numbers don't match up for you, that's okay, as long as that exhale is extended. What this is doing is actually changing the blood chemistry circulating throughout your body. It's allowing more oxygen to be picked up in the muscles that need it, like your uterus. So let's go ahead. I'll just do one quick timer and let's just close our eyes and practice this breathing technique. So I'll have everybody maybe just do one big exhale. That's it. I like hearing that. Sigh that out. And then let's slowly breathe in through our nose. And with each exhale, drop those shoulders a little bit lower. Beautiful. Loosen that jaw if you can every time you let that breath out. Just like in yoga class, in birth, we like to hear that breathing. Because if you don't, a lot of times you're holding your breath. So take those slow breaths in through your nose. Really sigh it out. Good. That's great. Let's just do maybe 2 or 3 more. Beautiful. And whenever you're ready, you can just blink those eyes open. How do we feel? Hopefully already like a little, a little calmer, a little soothed. This is a great thing to be using maybe in those earlier or active labor. When it's a little bit more effort, you have to focus on it, but it's not super extreme yet. This is also a great thing to do, like, hey, that contraction's over, shake it out, reset that body so that you can be relaxed and enjoy this, like, this downtime. So that's the calm breathing that we love to use. The next one I like to call surge breathing. In hypnobirthing, we change a bunch of words so that we don't have like certain connotations. So you can even ask your doctors, your nurses to say different things, you know, like asking about your comfort instead of asking about your pain. Because when I say like, what's your pain? You're gonna be like, oh yeah, I feel it right here. Versus comfort, I'm like, okay, I'm not like chilling on my couch comfortable, but I'm a little bit, you know, I can get it. But anyway, so surge breathing, we're talking about that wave. We're talking about that big contraction. One of the breathing techniques that we like to use is similar to what a lot of athletes do. So this is like some runners, I was gonna say swimming, but that's maybe not exactly the truth. Cyclists, rowers, things like that. This is a way to keep our heart rate a little bit lower, to keep us calm. Similar to what Andrea was mentioning earlier, is that when we have these deep breaths in our belly and in our diaphragm instead of in our chest, it's telling our body, hey, we're safe, we're in this comfortable place, we can easily have a baby, versus like if I'm breathing up here, you know, maybe there's a predator around the corner, I'm nervous about something. So this surge breathing, the idea with it is in 1 minute, let me backtrack and say it a different way. How many breath cycles can we slow down in 1 minute? So when I'm breathing, not really thinking about it, I probably breathe like 8 to 12 times in 60 seconds. Whereas when we're practicing the surge breathing, my average is probably 4 or 5 breath cycles. So that's another way, you know, maybe you're in that point where you're like, I need to know when this contraction is going to be over. Hey, average, I'm getting about 5 breaths per minute. It's probably going to take me that long to get there. You might see people online or in other places practicing this with like holding in a bucket of ice, sometimes squeezing a comb, or even doing a lovely little wall sit. This could be a good place to practice it. I personally do it on wall sits or while I'm doing a plank, just slowing down this breathing. So we're gonna practice this again, but the big idea with it is you can keep your hands on your diaphragm, like diaphragm breathing. We're gonna practice it once just seated here, and then maybe a couple of times in some different positions, and kind of mimic what it might be like in the most intense part of labor. I'm gonna be breathing really intensely, maybe mooing, making a lot of sounds, and then I have like another minute or two of just like, hey, exactly how we're hanging out now. I'm not in any pain, I'm not uncomfortable. And then, oh, this another contraction's here. Ooh, you know, really get those good breaths going. Before I do this timer and before we practice, that other thing that I just mentioned, I'll bring up again, mammals. When we are in labor, we all turn into some kind of mammal, other mammal, I should say, like cow mooing happens all the time. Lots of, you know, you're again leaning over. Ooh. Okay, lots of vocalizing. That can be super helpful for women to move through labor too. Sometimes I won't even lie, like a lot of hypnobirthing birth videos I see and people are silent. That works for some people, but a lot of people need to like get this energy moving through their body. And these low kind of almost like a om sounds, they're gonna help keep our throat open. They're gonna help keep our pelvic floor open as well. So those things, similarly to the breathing, also keep our nervous system in check. It's like, okay, we're safe, we're here, nothing is scary happening, just some weird things, you know, like the weirdest digestion movement happening in our body.
And they did research about tone of voice and what happens in your pelvic floor. If you have a high tone, You can like put your hand on like your pelvic floor. You'll feel it tighten up naturally. But if you drop your voice down, like you can really like feel it like let go. So
yeah, it could be a good thing to maybe even just try when you're sitting on the toilet. You might notice like just give a little squeal and then like a lowness, and you can feel the change when you're
it's
sitting
crazy.
there.
Mm-hmm.
Same thing with that jaw tightness. If you want to practice that, sit on the toilet and see me even just squeezing that once, I could feel like my butt cheek squeezed a little bit. But let's go ahead, let's practice this once sitting down. And I'm gonna have you again, close your eyes. Some people in labor like to keep their eyes open. Let's just, work with me here and do this. And I'm gonna have you try and count how many inhales you have on your hand, okay? And we'll kind of see how we're doing afterwards. But let's go ahead, empty that tank, blow everything out. And this first fake contraction is starting. Get that really slow, long, drawn inhale. And feel free, let it out. Make any oohing, moo, humming sounds. Let it out. Beautiful. Keep breathing that nice, slow pace. Imagining your jaw just getting looser, dropping down. Your forehead easing up. Beautiful. You're already coming down from that peak tightness of that contraction. Good. Keep letting that out. And this minute is over. You guys made it through your first practice contraction there. How we feeling? Great, hopefully. By show of hands, how many, if you were counting, how many breaths maybe did you get? Okay, 6, 4, 3.5. Okay, impressive with also being, I think you said 35 weeks, right? Okay. You might notice like the more that you continue to practice this, I don't want you to get anywhere like 1 or 2 breaths. 3.5, I wouldn't hold your breath longer than that. That's great though. So as you practice this, you might get closer to 4, maybe you stay around that 4 to 6 range, all great. That's gonna help you kind of focus and really tune into your body in that moment as well. So I figured, well, let me do maybe some counter pressure, and then we can practice maybe just a couple minutes of breathing in different positions and almost like mimic what labor will be like. Does anybody want to be a volunteer so I can show some different counter pressures with? Yeah, okay, wonderful. Would you mind just coming over here and I'll just have you kind of lounge on this ball for a moment?
Like a little blanket for your knees.
Probably okay.
Sure. Okay.
Okay, awesome. So these are some MVP moves that I want you to teach your partners, have practice on them and then have them practice on you before labor.
Maybe
because,
have her turn her butt the other way.
Oh yeah, can you face the mirror actually? We're just gonna show everybody your cute high knee. These things, I swear, like I do for hours as a doula with someone in labor. Every time a contraction comes, I'm squeezing the hips, holding it for a minute. Okay, the contraction's over, I'm letting go. And so hopefully your partners, they're gonna get a little bit of a taste of the workout. Yeah, get good biceps.
Chest.
So I'll show really quick on this pelvis actually. What we're looking for is, so when I'm touching on her hips and what I'm going to be looking for, I look for the side of her hips first, and then I kind of come in to more of this flat part. When you're talking to your partners or whoever is going to be, maybe doing this squeeze for you, I like to say making a butt cheek sandwich. We're squishing the butt cheeks together like this, and then we're kind of pushing up the back a little bit. So I'll show you on our, I'm sorry, can you remind me of your name? Rachel. Rachel, thank you. So I kind of find her hips on the side, and then I turn my hands in, and I squeeze her butt cheeks together, and I'm kind of pushing her a little bit forward. How's that feeling? Yeah, it should take off a lot of low back pressure here in this spine. And as I say, earlier on in pregnancy, you may or may not feel like, you're like, okay, it feels okay. I make my partner do this to me now, not pregnant, but probably as you're getting a little bit bigger, a little bit heavier, this will feel amazing. And so you'll have them squeeze, hold it. You might have to play around with positioning, sometimes a little bit higher up, sometimes a little bit lower on the butt cheeks. MVP move, use it probably every birth I've been at. Another one, are you okay to keep being a model? Thank you. Another one is this lovely sacral pressure. So it's very similar in that we're gonna be kind of squeezing, but we're gonna find this part of the sacrum with the palm of our hand, usually the bottom of it. I'm gonna find that curve part. It's usually just above your butt crack, and we're pushing down and forward. Both of these can be quite helpful if someone's experiencing back labor, but it's also really helpful regardless of where you might be feeling that tension. It can be a distraction tool, but also, again, it just feels really good. So I'm gonna find where that curve is just above her butt crack usually. And sometimes in labor, I'm literally putting my entire weight into this, but right now I'll be a little bit more gentle, but you just let me know. How's that feeling? So yeah, it takes off a lot of pressure. I usually just keep my hand here for a little stability, but sometimes I'm like, putting all of my weight into these moms. But these two items could be something that you have anybody do in different positions. A lot of women, like I mentioned earlier, maybe you're leaning over the bed, maybe you're holding on to the couch at home, forward leaning and going like this. Perfect place to get a lot of these counter pressures that can help just, again, take some tension off, distract you. It really just feels good. So I want you to go home, practice it a couple of times. Of course, as you move throughout your pregnancy too, it might feel different in what areas you like. Do you mind if I show one more with you? Thank you. Thank you for... The other item I was going to show is, so this is a rebozo. It's traditionally like a Guatemalan and Mayan heritage where women are gifted this. They use it throughout their pregnancy as a belly band or other support. They use it in labor for different tools and then to carry their babies afterwards. But you can use like a long scarf if you don't have one. You can use like a top sheet. But essentially what we're going to do, I'm just going to have... Can you wrap this around your belly for me? Thank you. Oh no. So leaning over, you can do this standing. I also have people who might be leaning over onto like a couch or a chair do this. Another one to really get your partners sweating with you. You can do this throughout your pregnancy. Again, at the end of the day, this is going to help take off a lot of tension in this lower back. I'm just going to gently lift. Feels good? Yeah. Usually the reaction you get. It takes a lot of pressure off. I can be holding this. I can be leaning back. You could do this every day at the end of the day. I feel like it's a great little routine to kind of get in and help you just sleep a little bit easier, take that stress of the day off. You can do a light sifting. Let me know, Rachel, how this feels. Some people like it, some people hate it. If you've just eaten, don't do this one. It can cause a little bit of nausea. Sometimes this helps kind of release some of those the round ligament that's holding your uterus in place. So this can kind of help ease some of that. But this is a great thing that you can be doing during a contraction. Sometimes taking the weight off the belly helps. I'm going to gently lower this for you really quick, and then I'm just going to show you one more. Thank you. In the same position is great. But this is something, you can be doing up until the end of pregnancy, in labor. Some women love things on their belly, some women don't. So just kind of seeing how you feel at that moment. This last one, kind of odd, it's my favorite. In a group called Spinning Babies, they have mapped all the different positions that babies are in and help kind of figure out how to get them in the most optimal position. In Spinning Babies, this one is called Shaking the Apples, but I like to call it labor twerking. So good thing, you signed up for this. Your partner, they can use their hands too. Sometimes I do just use my hands, but what I'll do here is just kind of tighten this around the booty and then just do a light jiggle. Yeah? What's that ooh? Is that a good ooh, hopefully? Okay.
It's fun.
So what this is doing, it's releasing fascia. So fascia is connective tissue that's in between our skin and muscles. And this can kind of help loosen it. It also is something that relaxes the nervous system. So you might see, I've done different things in labor where we're kind of like shaking and jiggling the thighs. The booty is always a great one because all of those muscles that we just learned about are all interconnected. And so if we can do a light release here, it's just going to make everything feel better. Again, another thing that I make my partner do to me, not pregnant. Thank you for volunteering. Yeah, go home and make them try these on you. What was I going to say? But the shaking, a light shaking is a great thing to be doing too with an epidural. So a lot of women, although we love that it takes away, pain and tension, sometimes that numbness can be a little weird for some people. And so, around the hips, around the thighs, just this light jiggle, almost like if you had your hand on in water and you're just making a ripple. Just doing that around your body can help kind of loosen up, give some blood flow, allow you to feel a little bit better in your body, whether you have an epidural or not. But I tend to use that a little bit more with an epidural just because it can get some movement in, get some blood flow, help us feel a little bit better when we're just kind of more in bed there. I'm trying to think. I was going to talk about pushing. So yes, I'll finish with that. Do we have enough time for that? Or did you want to do questions right now?
No, let's talk about pushing.
Okay, cool.
Everyone wants to know how to push.
Yes.
So that's a big question I get too.
Yeah.
How do I know I'm pushing?
Pushing.
So in my field, we check it internally. So, the last couple visits, okay, let's practice our push prep. And we're putting our finger on the pelvic floor through the vaginal canal. And I'll just say, hey, go ahead and push. And I see what happens. And some people can allow that pelvic floor to relax and bear down. Other people might be squeezing their pelvic floor, but they think they're pushing. And so I'm just retraining you to, okay, we're going to take an inhale breath, keep your pelvic floor soft, exhale, keep it soft, and then gently bear down. And I want to feel you giving birth to my finger.
Cute.
Or letting my finger come out, push it out. And so, we're just retraining that pelvic floor to make sure you actually know how to push. And I give you that feedback. So that's how we approach pushing in PT.
I love it. Yeah. I do not do any internal exams. And so just how I tend to like coach or talk about pushing in like very cute ways. It's gonna, your baby feels like the largest, most beautiful bowel movement of your life. It's like satisfying after they're out. It feels great. And also it's like, ooh, that's a lot of pressure. I have a lot of women ask me like, are you sure my baby's not coming out of my butthole? I promise they're not, but it does feel like that.
It's stretching it.
Yeah. It definitely, it feels there. But one way that I like to have people practice, like I call it birth breathing or pushing, is when you're having a bowel movement. So this is the place that I would encourage you to only practice. Dr. Andrea might have some other tips for you there too. But when you feel that pressure downwards, again, very crude, but like that prairie dog sensation, it's coming downwards, but maybe it's a little tough. You're gonna take that breath in, and instead of like holding your breath and kind of like, we've all been there trying to like grunt out a poop, take that breath in and imagine your breath, instead of blowing it across the room like you're blowing out a candle, that breath is staying near your body, almost like you're fogging up a mirror, like kind of thing. But we're gonna imagine it's kind of flowing down our body, almost like a snow plow. Kind of picture it coming down, pushing everything in front of it out and below. A lot of ways that they coach pushing in the hospital, it's pretty standard. Whether you have an epidural or not, the nurses are trained to teach you the contraction starts, you take a big deep breath in, hold your breath, and grunt and push as hard as you can into your bottom. Holding your breath, you may or may not need that at some point. I'm not going to say don't ever hold your breath because a lot of times it can be useful, but it's going to wear you out a lot. When you hold your breath, your baby is holding your breath too. So just kind of thinking about how can you, sometimes you need to hold that breath because it's putting pressure in your diaphragm. It's also adding on top of what your uterus is doing. But when you can breathe out, like Dr. Andrea was saying earlier, it releases your pelvic floor. You're going to conserve your energy, and pushing can take a long time. For an average first-time mom without an epidural, it can be 20 minutes or it could be 2 hours. With an epidural, it's probably about 2-ish hours to maybe longer. And part of that is because you can't feel what muscles you're using and relaxing. And so it sometimes takes like half an hour, 45 minutes to even figure out what you're doing. And that's okay. We know that happens. But like I said, for practicing the pushing feeling, I only want you to do it while you're having a bowel movement and just intuitively take those breaths. Try not to hold your breath and kind of like squeeze everything. As you take that big inhale, it's almost like encouraging you to kind of pucker your butthole out, like you're letting a fart out. How beautiful. Very cute way to welcome your baby into the world. But a lot of people, when they hold their breath, I just did it as I was like pretending to hold my breath, we squeeze. We squeeze upwards instead of releasing and letting all of these muscles kind of open up like a flower. That's a big imagery that hypnobirthing uses, is that your perineum is like a rose, perfect for those who are giving birth at rose, but these flower petals are kind of like unraveling and releasing gently and smoothly. And so as you're breathing, you can imagine that rose petal or that flower is unraveling in that way. And sometimes that can help people kind of visualize what that might feel like. But I know what everybody wants to hear is that, yeah, their baby feels like they're the biggest poop of their life. But I promise you, they probably will feel like that, and it will be beautiful and amazing no matter what. So, but yeah, that is what I have for pushing, I would say. If you wanted to add anything else on top of that, or
pooping does happen during labor too, and I would just let all anxieties about that just go. And if what I was told is like, if it happens, we clean it up so fast and you won't even know. Like I still don't know if I did or not. Like they didn't tell me, so who knows?
Yeah, why would they tell you?
Yeah, I don't know. They're not going to be like, you just pooped. So
yeah. I would say probably 90% of people do poop at some point, based on my experience. But it's like a bunny turd, and that's where I didn't bring them tonight. But like, not everybody loves essential oils. I'm not trying to push that, but sometimes having one just on a rag for pushing, can take an inhale of that in between, have it wafting. That can always just be a little relaxed.
Yeah, sure.
In case we do smell anything.
But yeah, like I labored on the toilet for a while.
Yeah.
Like I think that helped me, like, okay, I got this, like the pushing part. So
yeah. Actually, there was 2 other points just from earlier in our conversation tonight. When we were talking about potential tearing. I just was going to bring up the statistics that I have seen from my personal work. I have only seen 1 4th-degree tear, and that is unfortunately the very large one. I've seen like maybe 2 or 3 3rd degrees, but 2nd and 1st are those ones that heal really regularly, are very, very normally and healthily. And so those are the ones that we potentially see the most. But in the, roughly 160-ish births I've seen, 3 or 4 of them have been the severe. So it's really uncommon. And warm compresses are super helpful. Once you can start to see a little bit of your baby's head, the nurses, you can ask the nurses, the doctor, or any support people to kind of hold some compression there. It's like a little warm towel that usually is just kind of held right between your vagina and your rectum, or excuse me. And that's just bringing blood flow. Thinking about like a nice massage that you get, you have hot rocks or a hot towel, that's kind of helping and assisting there too. So that's always an option, at the hospital, whether you have an epidural or not, someone can hold that for you too. Kind of reduce that aspect.
Yeah. Fun fact, the perineum stretches 250% in that vaginal birth. So it's like the most stretched out tissue your body will ever experience in a short amount of time. So yeah, just like
cool.
Brings some awareness. I don't know. I love fun facts like that.
I like that fact.
Yeah, don't let it freak you out. You're here and you're gonna help learn how to like get your body ready for this. And like she said, it's very rare to have the really bad ones. And I have seen a couple of the really bad ones in here too, and they had to get surgery and things like that. So, but the 1s and 2s are pretty common and heal really nicely. So,
yeah.
Any questions as we wrap up? I know we threw a lot of information at you guys that I have some handouts printed off for you guys to take with you, but yeah, we just want to be in a really good resource. In pregnancy, we might have people coming in maybe they don't have a ton of issues, but just want to feel prepared and confident. So maybe they're coming in like once a month and just like, okay, we're checking their pelvic floor. How flexible is it? How are we doing with stretches and movement and exercise, and just being kind of your coach and support person, like leading up to birth. Some people might come in here because they're having a lot of pain or leakage. And so we're going to start to work on that before you give birth. So a couple options for that too is obviously like booking evaluation. You can come on in. Dr. Bree's going to do some free consults for the next couple of weeks. I think still she'll have some openings. So she does free 30-minute consults. It's not really an evaluation. It's just having a chat and seeing like, what are your issues? What are you concerned about? Like, what could we work on here, and seeing if that's something you want to do too. So she has some spots open for that. But yeah, we just want you guys to feel empowered and encouraged, and that you can do this, and it's going to be great. Yeah.
Awesome. Yeah. Any questions about anything that we covered or didn't cover that you wanted to know about before we leave?
Yeah.
With the ab workouts, you said like lots of people can do lots of different things. Like, how do you know if an ab workout is not good?
Good question. So pain is a big factor. If I'm taking you through different ab movements and you're not doing them correctly or they're painful, like I'm going to modify and adjust that. So it's just super individualized based on the person. Like, if you're like a CrossFitter versus if you do bar and Pilates, I mean, those exercises are going to probably look different, and I'm going to tailor that based on like what activities are you still trying to do that you want to do. But yeah, there's lots of different ways we can work the core that aren't just, the easy peasy ones too. We have a whole library of things to work on. So, but yeah, I would say pain. And then sometimes seeing that coning or doming, there's a lot of research coming out now that it's kind of like an it depends answer, but like there are moments where like if we don't have our abs right and we're trying to do these like planks, like I'm going to give you something else to do. Like that's just not going to serve you. That's going to put a lot of pressure on your abdominal wall. So it's really just kind of like it depends answer based on like how you're doing the exercise. Are you doing it correctly? Are you just losing your abs? I want that ab wall to like work well before I'm going to give you like harder stuff to do too. So yeah, good question. Yeah.
You like, I don't know what they're called, they're like belly bands.
Yeah.
Do you
Mhm.
recommend those, or?
Yeah, it's kind of like a comfort measure too. I don't think there's any like research-based like stuff with that. Sometimes those are nice in postpartum for support, especially if you've had a C-section, because the abdominal wall is cut all the way through, just to help give you some compression in postpartum. For the people that are having a lot of hip pain, pubic pain, SI pain, I might recommend a more sturdy belt, like an SI belt, to like really compress and zip up your pelvis there to help support you. But the belly bands, it's usually just like, oh yeah, that just feels nice. It feels like a little nice hug. Like, your belly's getting pulled down so much. It's like, okay, that just feels like someone's just, if your partner comes around and like pulls your belly up, that just feels really nice. So
Yeah.
Yeah.
I see those being nice too if like maybe some of those first kind of walks that you're doing, even if it's a short walk, I've seen some people like just
Mhm.
like that it feels, because like your belly kind of feels like a waterbed right after your baby is
super
born.
squishy.
Yeah. And so having that on maybe like a day where you might be moving up and down your stairs more frequently or something, I see as like
Yeah.
can just be
More
like a
movement
nice
days.
support.
Yeah, it's just like a nice hug, I tell people.
Yeah.
This feels good. Yeah, good question. But yeah, anything else? Good.
We talked about some of the different like symptoms that can come up from the pelvic floor.
Mhm.
I've had like tailbone pain specifically, and you
Mhm.
didn't mention that. Is that?
Oh yeah, sorry. Yes. Oops. Yeah, so
fine.
here's our coccyx, our tailbone, all the red stuff is attaching there. So yeah, we have a lot of specific pelvic floor muscle attachments to the coccyx and distal sacrum there. Absolutely. So we are usually working on releasing those tight muscles through internal work, stretches, breathing, just certain movements and positions. So yeah, big tip for that one is just really, I love different tailbone cushions. Cushion Lab makes one that I really like, but it just has like a little, it's not a donut, it's not a hole in the middle, it's more of like a little cutout at the back of the cushion. It has like a little hole in it. So yeah, just trying to get off your tailbone as much as possible so you don't keep irritating it. Sitting on your sit bones, maybe put a little more pressure on your pubic bone and your sit bones than sitting on your tailbone too. So, but yeah, we can work on releasing that for you for sure. Yeah, cool. Yeah, you guys are free to go. If you guys want to do any like consultation with us, just come up and let me know. We can schedule something for you guys too. So yeah. Thanks for coming.
Yeah,
And
thank
can we
you.
take, I'm gonna turn off the recording. Can we take a quick group photo?
Where do you want us?